Good afternoon. My name is Brooke Malloy, and today I would like to discuss an impactful clinical experience that I had as a new grad nurse, as an ADN, and basically how my clinical judgment and decision making differed then compared to how potentially it would differ now, or differ if I was an MSN prepared nurse. So I was a brand new nurse. I was coming onto shift, working night shift, and the day shift told me, giving me a report about my patient. She was a 20-year-old female, newly diagnosed with anemia, and there were orders for her to have her first blood transfusion. The blood was not ready yet from the lab. As soon as we were done with the report, the blood was ready, so we went down to the lab. And I hung the blood following protocol to stay with the patient the first 15 minutes that the transfusion was occurring. So within those 15 minutes, the patient displayed signs and symptoms of developing a blood transfusion reaction, exemplified by her degree, her temperature increasing by 4 degrees in 15 minutes. Her chest was red, her throat was scratchy, eyes were bloodshot, heart rate increased from 80s to the 120s. So I knew in my brain that what I learned from nursing school is this patient is having a blood transfusion reaction. Mind you, this is my first shift on my own. I'm off preceptor shift freshly. This is my first night solely by myself. My preceptor was working, but she had a different assignment. Therefore, when all of this started to happen, I went to my charge nurse thinking that she was my point of contact in terms of leadership. She can guide me in what to do because I didn't know what to do to help this patient, and I was worried that she was going to code on me. So I went to my charge nurse, I explained the situation. She was in the middle of a conversation with someone else. However, I felt as though the information that I needed to relay was a little more important than um, maybe some gossip, or they were talking about a sale, something that doesn't have anything to do with patient care. So I explained to her what happened, and she said, "I'll be there in a minute." And so I felt as though what my concerns were weighed heavier of importance. And so I said, "No, I'm really concerned. I need you to come right now. I'm really concerned about this patient." So she came with me to the room to assess the patient. While she was in there with me, another one of my patients was on the call light. So since she was in there and the blood was paused, I figured, let me go see what this other patient needs. They just wanted a cup of coffee. So I grabbed them a cup of coffee, went back into the room to find that my charge nurse was no longer in the room and my blood was restarted. This was my concern because I was concerned about patient safety. That was my priority. And I felt as though my concerns were just being dismissed. So I went back out to her and I said, "Hey, you think she's okay? I'm really, she's having a transfusion reaction." She said, "No, that's not happening. Sometimes um, this happens when patients have never received a blood transfusion before. It can be normal." At this point, I'm tearful because I don't want this poor young woman to die on my hands, and I don't know how to fix it. So I went to my preceptor. Luckily, she was there working on the floor with a different assignment. I explained to her the situation. She did validate my concerns that yes, she also believes she's having a transfusion reaction. She walked me through the steps of calling the MD, getting the proper medications ordered, administered the meds. All of her side effects went away, and she ended up being okay with just the Venofer transfusion, elevated her hemoglobin and hematocrit count. So, as a new grad nurse compared to an MSN nurse in this situation, I believe that now I would be able to better handle the situation. Simply because what I was going through, I was utilizing applied nursing ethics, right? The nursing process. I was assessing the situation. I was diagnosing that I think she was having a blood transfusion reaction. I was trying to plan by grabbing, my leadership, having me help assess the situation to verify that my concerns were valid, which now, with an MSN education, I would know that my concerns were valid and I would be able to completely skip that step. And I would be able to know I need to go to the physician. I need to get these orders for meds in order to increase this patient's chance of survival, right? So all of the time I was buffering, going to the charge nurse, having her come and check on the patient, leaving the patient because she restarted the blood, going back to the charge nurse, then going to my preceptor. All of that time, I could have been acting instead of running around worrying what was going on. In terms of evidence to support my perspective, I mean, we can always look at Tanner's clinical judgment model, right? Essentially, this clinical judgment model catalyzed nursing educations, basically have already piqued interest, right? These new grad students have already piqued interest in how, their ethical thinking will be, their clinical reasoning, and clinical judgment influencing patient safety and how those skills are taught and measured. So, as these newly educated nurses are going into the field compared to someone who would have advanced further, advanced education, applying that to a clinical scenario models Tanner's clinical judgment model in the essence of, patient safety and basically how these skills are taught in school compared to, in ADN program, I should clarify, compared to what the steps of action would be in terms of an MSM prepared nurse differ greatly. And the outcome here is the success rates or survival rates, rather, of our patients. Um, and graduate level nursing education impacts my individual perspectives because graduate level nursing, it really has broadened my perspective regarding personal ethics, beliefs, and my values. It gives a better overall picture of nursing in and of itself. Why do we do what we do? We act immediately on these things because of X, Y, and Z. Um, you really, in your master's prepared programs, you really delve deep into topics, models, and theories, such as Tanner's clinical judgment model that apply to these clinical scenarios. So this clinical scenario I've had under my belt for years. But however, now being an MSM prepared nurse, I'm able to apply this model to the actions that I had went through 5 years ago, but I'm now able to recognize and apply that to practice, and sometimes we subconsciously, uh, do these actions, go through the motions, take care of our patients. But again, as a master prepared nurse, you're able to pull these scenarios and apply these models and theories to modern day practice. So, being an MSN prepared nurse essentially opens up the knowledge. And different perspectives of nursing, making you a better and well rounded nurse, which is why I feel as though if I was in that situation now or when I am MSN prepared, I would have been able to handle that situation much more effectively than I did at the time. And so, for that reason, we should be pushing to hire more MSN prepared nurses to avoid patient safety compromise, really, is what it comes down to. So, thank you so much for in and taking the time to hear my clinical experience and really my rationale as to why an MSM prepared nurse as opposed to a ADN or a BSN nurse would have handled that situation differently. Have a great day.